Well, the future of healthcare in South Africa seems to be at a crossroads. As discussions around the NHI continue, a coalition of medical professionals is offering a different path forward. The Universal Healthcare Access Coalition, which comprises over 18 groups, which includes the South African Medical Association and the Progressive Health Forum, believe their framework offers a more immediate and practical solution to the healthcare crisis in the country. So let's get a better understanding of their proposed framework. And the Universal Healthcare Access Coalition Steering Committee member, Professor Alex van den Heever, joins us now for more. Alex, good morning, and thank you very much for your time. I don't think there's anyone in South Africa, whether you're in the public or the private healthcare system, that wants more efficiencies and wants to pay less for quality healthcare in the country. What you as a coalition have done is you've outlined, I think I've counted 15 points of differences and upgrades in your proposal to what's currently on the table. We might not be able to get through all of them, but in the main, explain to us what you're proposing and the areas, some of the areas, maybe two or three areas that beat what's currently on the table in the way that NHI has been proposed to us.
So firstly, the impetus for creating this proposal is that the national health insurance proposals themselves have become an obstacle to any kind of reform in the health system. They're reinforcing the status quo because while there's this promise of NHI, nothing is actually happening on the ground and none of the problems that have been identified are being addressed. So a large part of making this proposal is in fact to get actual reforms happening in the system that are necessary to move from the status quo. So the national health insurance proposals sort of propose to eliminate the provincial health system and the medical scheme system and combine it in a new system where all your coverage will come from a single fund. This means that is a massive restructuring of the health system with no real likelihood of an improvement in outcomes. And the problem is waiting for that impossible framework to come means nothing else will be done. So the framework that is proposed looks at basically the specific improvements that are required to the public health system and the specific governance framework improvements to the private sector that are necessary for both those systems to operate forward. You cannot have a system based entirely on tax revenue because you will not get all the resources that are required for the health system based on a tax-funded system alone, which is what the NHI is. So the framework proposes that we have a contributory system that is retained as well as a tax-funded system, that we target dealing directly with the governance weaknesses that are promoting corruption and poor delivery in the public health system. And in the private system, we're looking at the implementation of the health market inquiry recommendations that would stabilize and protect the sustainability of the medical scheme system. And in addition to that, to look at mechanisms that harmonize the way in which the private sector functions with the public sector. So strategically, you harmonize the two systems so that there is a sharing of resources and a sharing of access to provision. But this has to be built. And basically, the framework that is proposed looks at the requirements to build that framework. And it basically draws on two revenue sources, contributory systems and the tax finance system. There is no other alternative in South Africa. And once you recognize that, you have to invest in the structure that is organized along those lines.
Yeah. So let's stay then with the funding mechanism aspect, which you've just explained to us now. If we look at the spread of services and the use of those services across the South African landscape, the numbers that I've quoted, which you've actually provided, is that the public sector serves about 80, or the public institutions serve about 84% of the populace, and the private institutions serve around 16%. So going back to the funding mechanisms, but also looking at outcomes and efficiencies and access for that 84%, how will it shift or remodulate both the distribution and the cost? Because even though you're paying medical aid, we all know it's a grudge cost. It is very, very expensive. Could those on private medical schemes also ultimately, under your model, be paying less?
So the important reforms required on the medical scheme system are necessary to bring down the costs over time. to restructure the incentives and the way in which that system operates. It's impossible to go through all the detail of what is required in that framework, but they were detailed in substantially in the Health Market Inquiry Report, which is a Competition Commission evaluation of the system that took 5 years. That reinforced recommendations over a number of years on what needs to happen in the private sector. If you don't introduce those structural reforms, it's impossible to have the medical scheme system become more more affordable. So they are necessary. So you want to bring down those costs, and on the public sector side, the only option is to be able to grow the resources in line with economic growth. We are not going to be able to increase taxation and fund the public sector more than is possible, because we're at the tax threshold at the moment. We're at the ceiling of what can be raised by general taxes. So what you want to make sure that the productivity of the public sector is massively improved through the introduction of measures that separate the executive of government from the delivery of public healthcare services. And that is quite crucial to changing leadership, the leadership arrangements in provincial health administrations, so that the people who are meant to be running hospitals are running them, and the people who are meant to be running district authorities are running them, plus that they have the kind of control over those services that they're meant to have. So we make recommendations on how to improve the productivity of the public system, which will massively improve delivery, subject to financial constraints. But there are wider issues that also deal with the inconsistencies between the way national government sets remuneration and transfers the costs of those decisions onto the provinces without properly funding them. That alignment is also covered in the framework as well. It's necessary to make sure there's national provincial alignment. It's necessary to ensure that the executive of government is kept separate from delivery, because they are responsible for essentially deploying networks of extraction into the provincial health services, which have destroyed their capabilities over the last 15 to 20 years.
So one of the big criticisms, perhaps among the loudest criticisms of NHI, is the lack of detail, which you do go to in some of the aspects that you raise, and how your plan is more detailed and then makes it a more attractive option or alternative to NHI. I just want to ask two questions on a practical level, Alex. And the one is, of course, it can't be done without the cooperation of the health department, and where that might be in terms of having a discussion with the health ministry or the DGs or whomever those stakeholders in that universe are, as a way to either help them with the way that they foresee and develop NHI. Although I know that some entities who are under the UHAC have been, diametrically opposed to government, including the South African Medical Association, for example. So I don't know where that relationship is. I know that's a mouthful. Coming to the question, Alex, and the question is, how do you know that your plan works, given that you would need the input of the health department and the institutions to pilot this, to model this?
So firstly, the reforms that are required absolutely require, but on both the private sector and the public sector, require government to implement them. So at the end of the day, it is necessary that government buy into this kind of framework going forward. We have provided the document and reasoning to the President directly on his request, and it's available. It's been supplied to the Minister of Health. We don't necessarily expect that, given the politics operating within the ANC, that we're necessarily going to get a sort of a coherent response now. But what we are doing is establishing a convening space for a conversation by the health system to formulate the kind of reform that we need in South Africa. And that in itself is going to be an important readying factor to get government to basically cooperate on doing its job, which it's not doing at the moment. And I would say that the danger that we have at the moment is that government pretends it's doing its job by saying it's implementing NHI, but NHI has become an excuse to do nothing. And this is the risk that we face. So what we're doing is essentially creating a convening space for the whole health system to have a conversation on coherent reform. So there's a single voice at the end of the day who are participating in a coherent proposal that gets put to government that becomes impossible to ignore. And we stop having a conversation only about a reform that basically is just never going to be implemented and holds up all actual reform and all focus on problem solving in the current systems. So this is an attempt really to shift the needle and get government to focus on its job. We don't expect that it's necessarily going to happen immediately, but essentially this is the only thing that can be done, because it's problematic just sitting and doing nothing and watching this disaster unveil for the country.
Let's talk about timeframes, Alex, and what it would take to bring to life this alternative.
So I think that in many respects, this framework is largely a structural change. In other words, it requires legislative instruments to be deployed, not additional financing. So what you're doing is changing the governance structures, which potentially require national legislation to change. And note there are a number of things that are in the report that also talk to other things that might take a little bit longer, like the requirement to establish a sort of a universal framework for managing access to critical care services, so that we don't differentiate between public and private for that. There's been nothing for 30 years to solve that problem. So that's they're going to be those deeper cuts. But the issue of the governance reforms are largely structural, legislative, and then they're bedded down over time. In the case of the private sector, the establishment of the risk equalization mechanisms, the proposal for the pooling frameworks, they were actually in implementation up until 2008, and then were all brought to a halt because supposedly medical schemes weren't going to exist anymore under NHI. So from 2008 to now, nothing has been done about the private sector. So the reform frameworks were actually fully developed and can basically be re-implemented. And it's important to note that the reforms up until 2008 were reinforced in the recommendations of the Health Market Inquiry. They re-recommended those very measures, which was based on a 5-year process of detailed diagnostic analysis of the private sector and the public. You can implement that framework over a period of about 3 to 4 years. It doesn't require additional government funding. It really requires that there are concerted efforts to design instruments and institutions to be able to deliver those pooling mechanisms and implement those. Minimum benefit frameworks and the structures for a lot of those interventions that are there also just require the establishment of proper organizations that are independent of political influence, but make important decisions about minimum benefits in South Africa, not committees of the minister, but actual authorities that make independent decisions that can't be influenced by other kind of inducements that are entered into the system. So the provincial restructuring, the governance frameworks could be done within a year and implemented over time, because we'd basically be changing the leadership structure of our public hospitals and the establishment of a district health authority system, all of which is a legislative change coupled with the bedding down of those institutions. So I would say you could get a considerable amount of this framework in position within a 5-year period. But if you look at the Government of National Unity's statements on health reform in the SONA, all we're going to get supposedly in the next 3 years is electronic patient record systems.
All right.
And I doubt they will even be implemented.
Well, given that stance, which is just a day or two old, the historic, consistent, repeated, passionate defenses of NHI in the way that it's being presented to the public by the health minister, is this plan dead in the water? I mean, what happens?
Well, I don't think that this minister will take forward what's being proposed, but the intention is not to persuade this minister what to do. The issue is actually coming to a consensus on what needs to be done and making it very, very clear to everybody what needs to be done, so that you can't have anybody in government being able to avoid the issue of the sort of the practical problems and steps that need to be taken to address them. We're making them very, very explicit. Government can ignore those, but we would argue that they would be ignoring them at their peril, because now there's going to be a very public conversation on what needs to be done, and ignoring them shows that you have another agenda that has nothing to do with the implementation of universal health coverage.
Don't you think you have to do better than that, Alex, than say, well, here it is, we've put this work in, it definitely is a more urgent, more cost-effective, more implementable plan than yours. So rather than alienating the minister, or as you say, just accepting that this is the status quo and you're not going to get a hearing, you don't have any say over which minister might be favorable to this, is to rather, seek to continue to build consensus and bring the custodians of NHI around the table?
Well, hopefully that is the end point, but we're presenting this to the whole of government and not just to one department, because health reform is a whole of government response. It is also a government of national unity, and we've also got a different parliamentary structure than we might have had than we had 4 years ago. So all of those impact on the political dynamic that will have to look and take into account these proposals. So I think that at the end of the day, it might not be up to just one minister, but it would be desirable for the minister to have an open mind. The only problem is that up until this point, he has not shown that he has an open mind. But the idea would be that we need to have real conversations on health reform, and we needed to bring it to that point. The other issue is that up until this point, many people within the health system felt, well, we leave it up to government, and government determines a process, and we will kind of send in our little document and proposal from the side, and hope government takes it into account. With that, if you look at the number of people who've signed on to this particular report, it's now up to about 30 or so associations, and they're more than just doctors. It's doctors, hospital groups, medical scheme groups, of Board of Health funders is also part of this. The issue is that what's happened is that instead of siloed proposals, this becomes a considered consensus position of all the experts in the health system.
All right, Alex.
And so it just stops having this very fragmented voice on what is required going forward, and that also changes the dynamic. It's a clarity of what needs to happen.